Thank you, Martin Cowie, Professor of Cardiology at Imperial College and the Brompton Hospital, for joining us to address issues around heart failure and COVID-19 during this very worrying pandemic that we're living through. Thank you for joining us.
Pleasure.
Could you explain what is heart failure, please?
Well, heart failure sounds a very worrying term. A lot of people think it sounds as if your heart's about to stop, and that's not the case. It's the medical term we use to describe the situation when your heart's not pumping as strongly as it used to do. And people would generally notice that by being more out of puff if they're doing some exertion, for example, climbing the stairs at home or going up an incline. They may have to stop, they feel more breathless. Or some people, it's actually fluid builds up, sometimes in the tummy, more often in the legs. And that swelling is a sign that the body's trying to cope with the heart not pumping so well. Important thing to know is that we've got good diagnosis available. And once we make a diagnosis, we work out what's causing the heart failure and can have a treatment plan for that to make a big difference. And most people can get back to a very good quality of life with proper diagnosis and treatment.
Thank you. And of course, you discussed treatment options, and there's our patient resources on heart failure under our patient resources section on the website. However, we've been receiving a lot of questions from patients with heart failure concerned, mainly, are they at higher risk of contracting COVID-19 if they have heart failure?
Yes, so in terms of the risk, I think the best way of looking at that is that the virus has to get to you. So you have to be in contact with somebody that has the virus to do that. Heart failure patients aren't in the really, really high risk group that have to so-called shelter and kind of take themselves out of society for weeks at a time and have their shopping delivered, their drugs delivered, and not have any human contact. Heart failure is not on that list, neither is atrial fibrillation on its own. So unless you have underlying other problems, such as chemotherapy for cancer or chronic lung disease that's very severe, or cystic fibrosis, you don't have to shelter yourself from COVID. But you do have to be cautious, of course, because we know that if you do develop the COVID infection, it's going to probably be a worse infection for you than somebody that doesn't have heart failure, and particularly if you're older, because we know that older you are, the worse it tends to affect you. So I don't want people to feel, oh my gosh, I have to take myself away for months on end and not interact with anybody. That's not the case, but be sensible. And currently, and of course the rules change all the time, but currently really you should only be meeting people outside your own household group, outside in the open air, and usually only with one person, and you should stay at least 6 feet away from each other. If you do have to use public transport, then wear a mask is also important, and try and avoid the times when it's really crowded, and try and avoid crowded situations in general. So those are the general things about heart failure that apply to COVID, but most of them are actually applied to anybody at this present time.
One person asked, should they continue with their medications for heart failure during the crisis?
Absolutely yes. Do not stop anything. And there's no evidence whatsoever, and people have looked at this very carefully, that any of the drugs that we use for heart failure, including things like ACE inhibitors, angiotensin receptor blockers, are likely to increase your risk of developing COVID or having a bad experience with the infection if you do get it. So please, please, please keep taking your medication as normal. If you think your heart failure is getting worse and you're getting more breathless, more fluid building up, don't ignore it. Don't put it down to something like, oh dear, I don't want to bother anyone. It's very important you get input to that through your heart failure team, maybe a nurse, or phoning your general practitioner, or even phoning 111 or online resources as well. And Trudy, you've got lots of resources on your website as well that answer questions about heart failure and also about atrial fibrillation.
Absolutely, and we've got our 24-hour helpline, but if you're feeling unwell, then absolutely call your doctor, call 111, etc. But we're also here to provide the emotional support. One last question. If a heart failure patient develops COVID, what should they do?
So I think the general advice is if you develop symptoms, and this could be cough, it could be a runny nose, it could be a fever, then you might well have COVID. So the general advice is that you should then isolate yourself. If you live on your own, it's for 7 days. By that stage, hopefully you're not infectious, you've come through it. If you live in a family, then of course everybody in the family has to isolate for 14 days to make sure it runs through your whole household and you don't then go out and infect other people. For most people, including people with heart failure and other cardiac problems, COVID is a relatively minor inconvenience, a bit like the flu. But for a minority, of course, it can be devastatingly worse than that. So the important thing is if you're not getting better after a few days, you feel really unwell, you feel lightheaded, you've still got very high fever, just generally not doing well, don't ignore that. Phone 111 or access 111. They can arrange to assess you remotely. Don't go to your general practitioner. You don't want to infect everybody at the general practice. Phone 111. They can assess you. And if they think you need to be admitted to hospital as the safest place for you at that time, they will do that. On the other hand, if they feel, well, yes, you're sick, but you're probably coming through okay, they may leave you at home as the safest place to be. So I think don't ignore your symptoms, but for most people, they'll be fine. But for the minority where really it does cause major problems, if you have to go into hospital, you have to go into hospital and you'll be in a safe place there and people can look after you as you come through that illness. But Trudy, I think it's really important. The media loves stories about the sickest people with COVID, the ones that are in hospital for the longest period of time. But for the vast majority of people, COVID is just like the flu, and they will recover from it without anything specific happening. So it's important to keep it in balance and not get terrified.
Professor Martin Cowie, thank you so much for your reassuring and expert advice on heart failure. Thank you.
Pleasure, Trudy. Thank you.